Hello,
Hello, doctor.
I am Dr. Biswas. I am a doctor of this clinic. May I confirm your name and age, please?
Yes, doctor. I am Mrs. Jennifer Lawrence, 67 years.
Nice to meet you. How can I address you?
You can call me Jennifer.
Okay, Mrs. Jennifer. I am here to discuss about your health condition. Is that okay for you?
Yes, doctor. That's all right.
Okay. And during our conversation, I may take down some note, but all the information during our conversation will be remain confidential. So is that okay for you?
Yes, doctor. It's completely okay.
I came to know that you have headache for last couple of days. Is it right?
Yes, doctor.
So can you please tell me in more details what is happening with you?
Well, doctor, headache is actually not a new problem to me. Okay, I had from the early 30s. I had some issues with my migraine, so I have had experiences of headache. Okay, but I have also used to take medication for a long time for that problem. But this time I think it's quite different, doctor. It is a new type of headache. Okay, and I think it's very boring type of headache, and I feel very irritated, doctor, for this. For the last 2 days, I think it's troubling me a lot.
I'm sorry to hear that. Can you please tell me where do you feel the pain? Which
I
part of it?
think, doctor. Uh, Doctor, I don't think that it's a whole head, doctor. I think that it's more in the side part, in the right side part. I think it's more.
Okay. And you had told me that you had migraine. Where did you feel the migraine?
Doctor, I think most of the time I had that problem of migraine in the left side, doctor.
Okay. And it is on the right side.
Yes, doctor.
And can you tell me that when did it started exactly?
Doctor, I think it started very quickly.
And for
Two
how
days,
long?
doctor.
Today.
I think that doctor, since the beginning, I think it's more or less the same, and it's been present for the last 2 days, doctor. I am quite afraid. I have never had. I had that issues of migraine previously, but it never continued for so long, doctor, and it was quite different.
I'm sorry, and let me find out what has happened to you. And can you tell me that do you think that the pain is increasing in intensity or severity?
Yes, doctor. I think it's getting worse, doctor.
And for the last 2 days, do you feel the pain all the day or all the time or any specific time?
Doctor, now I am feeling that it's more or less all the time, doctor.
Okay. And can you tell me that how would you describe the feeling of your pain?
I think, doctor. I think it's a dull, boring type of pain, doctor.
Okay. And can you tell me that does this pain go anywhere in your neck or any side in your face?
No, doctor. No, I haven't felt so.
And along with this pain, do you have any sore to touch this area?
No, doctor.
Have you noticed that combing or
Sorry, what did you tell?
have you noticed that combing or touching over the area brings pain?
Combing.
Yes,
Doctor, I am a bald person. I don't use that combing, doctor.
I'm
Sorry,
sorry for
but
that. And I have noticed
yeah.
that touching this area brings the pain or increases the intensity of your pain.
Well, doctor, that's a new thing, doctor. Yes, you have noticed it correctly. In the migraine type, actually, that also happened in one side, also not the whole brain, no whole head. Okay, but at the time when I touched the head while I had migraine problems, I never used to feel any pain. But this time, for the last 2 days, I think that whenever I touch my head in that side, in the right side, I feel more or less pain, doctor.
And can you show me exactly where did you feel the pain?
I think it's the temporal regions.
I'm sorry to hear that. And have you noticed any changes in your vision for this time being? Any blurring?
Yeah, doctor. Yeah. That's a very, very grave issue, doctor. That's another cause why I'm very much worried, doctor. I think I have been experiencing some problems with my vision. I think that there is some cartoon coming down from upper side. Okay, I think just like a cartoon coming down to in the right eye. So this has actually occurred 2 to 3 times during the last 2 days, doctor. I am very worried.
And when did it started? How long it persisted?
Doctor, I think it persisted for around uh, at the first time it persisted for very short time actually, 1 to 2 minutes. But the next two episodes, I think it gradually this time span increased, doctor.
And was there any symptoms like that you couldn't see completely with the right eye?
Doctor, I think the last episode was a bit like that because that curtain came down and it actually persisted for quite a long time. So I was quite actually worried, doctor.
And do you feel any pain in your eyes?
Uh, Not significantly, doctor.
Have you noticed any glaring or zigzag line in front of your eyes?
No, doctor.
Okay. And have you noticed any color of your eyes? Any changes in the color of your eyes?
Doctor, I have noticed.
Have you noticed any pain during your chewing or any swallowing or any talking?
Yeah, doctor. Yeah, I have been facing this from the last 2 days.
Sorry to hear that. And it didn't happen before.
No, doctor, I have noticed like that before, doctor.
I'm sorry for that. And have you do you feel any problem with swallowing?
No, doctor.
Just pain.
Yes, doctor.
And have you noticed any changes in your speech?
No, doctor.
Any weakness at any side of your body?
Not this time, doctor. But previously, I had had one stroke around 7 years back.
I'm sorry for that. And I am coming for that later. And I am going to ask you a few other questions that do you notice any changes in your mood?
No, doctor.
That's fine. Any rash anywhere in your body?
No,
How about your appetite?
it's quite good, doctor.
Have you noticed any changes in your weight?
No, doctor.
Any hot or cold preferences?
No, doctor.
Any pain anywhere in your body? Any other
No, doctor.
pain? What the muscle, any joints?
Not muscle, doctor. But I think that I have.
Hello.
Hello.
Yes.
Can you hear?
Yes. Do you have any
Can
pain?
you please repeat? It was a bit.
Do
Yeah.
you have any pain at any side of your body except your headache?
Yes, doctor. Recently, I have for the last 5, 7 days, doctor, I have also feeling that whenever I want to get up, I think there is some problem or there is some problem in my shoulder as well. I think there is some stiffness. I think I haven't faced this before.
And sorry for that. And do you have any shortness of breath?
No, doctor.
Any racing or pacing of your heart?
No.
Any coughing?
No.
Any chest pain?
No.
Any lumps or bumps anywhere in your body?
No, doctor.
How about your bowel work?
Quite good.
How about your water work?
Quite good, doctor.
Okay, that's fine. And do you have any past medical condition? One thing that you said you have a stroke 7 years back. Anything else?
Yeah, yes, doctor. I have some problems with my blood pressure and blood sugar, both, doctor. I have a problem with diabetes for last 10 years and high blood pressure for the last 20 years, doctor.
And are you checking those regularly? Are you going to visit your doctor regularly for high blood pressure and high blood sugar?
Yes, doctor.
And are they under control?
Yes, doctor. I think they are more or less under control, doctor.
Do you know your last HbA1c level or 3 months average blood sugar level?
Yeah, I think the last HbA1c level I know about it. It was, I think, 5.2, doctor.
Okay. And do you visit your eye doctor and kidney doctor regularly?
Yes, doctor. I went 1 year back actually to the eye doctor
And did they
and
find
kidney
any
doctor
problem?
around 2 years back.
Did they find any problem with?
Doc- Uh, the eye doctor said that I had some mild problems, but they said that at that moment it was not necessary to go for operation.
Okay, that is good. And do you know your cholesterol level?
Yes, doctor. When I had the stroke, it was a bit excess, so they gave me some tablets. I think some statins. I think, but I have been quite well. Later on, when I did those checkups, most of the time it was found normal.
Okay, that is good. And any other past medical condition do you have? Any hospital admission, any blood transfusion or anything else? Any
No,
surgery?
doctor.
Okay.
No, doctor.
Okay. And may I know that what are your medication list or what medications are you taking? Can you show me the medication list?
Yes, for hypertension, he takes AC inhibitor. Okay, and for diabetes, he takes insulin.
And are you taking those medication regularly?
Yes, doctor.
Have you ever felt any problem due to this medication? Any shakiness, any unconsciousness, anything else?
No, doctor. I think at the beginning, when I was just diagnosed with diabetes, first of all, for the first 2 years, I went with some oral medication. Then they switched to insulin, and at the beginning, I had some problem. Okay, I had some problem because I couldn't take those regular meals. Okay, but so later on, my doctors actually counseled me well, and now I don't have those problems.
Okay, happy to hear that. And may I know that any of your family members have this type of condition or any other condition?
No, doctor, I don't know.
Okay. And is it okay if I ask you a few personal questions?
Yes.
May I know that do you smoke cigarette?
No, doctor.
That's fine. Have you ever smoked?
No, doctor.
That's good. And may I know that do you drink alcohol?
Yes, doctor. Within the social limit, doctor.
Any beans drinking?
No,
That is fine. And may I know that what do you do for living?
doctor. I am a retired person now, doctor.
And if you don't mind, may I know that do you need any social support or any economical support at your home?
Doctor, now I live alone, doctor. It would be better if I had some social support, doctor. I have money, doctor. I don't have problem with money.
Okay, I will contact the social care department and they will be able to help you. Is that okay?
Okay, doctor.
And may I know that do you have any other concern or any question for me?
Well, doctor, what's happening? Is it another stroke, doctor?
Okay, before I give you answer, may I know that do you drive?
Yes, doctor. Sometimes.
Okay, and for that, I would like to recommend you stop driving until we are sure that what is happening with you.
Okay, doctor.
Okay, as I have taken your history, that your concern was that it was a stroke or not. As I have taken your history, it seems likely that it is probably not a stroke, rather it is a condition. We call it temporal arteritis or giant cell arteritis. Have you ever heard of it?
No, doctor. What you're telling me about?
Actually, in this condition, the blood channel on our forehead that you are having some soreness on touching what that area, it gets narrowed and it's get short, it gets soreness, so that you are having this headache and also having problem with your vision and also having problem in your chewing. For this
Okay.
for this we need to give you some medication immediately, otherwise it
Okay.
can affect your vision. And I am and you also we also recommend you to be get admitted, and we are going to start that medication. And in the meantime, we are going to run some blood test, some imaging test, and we may need to some muscle test, that is called biopsy from the blood channel of your forehead. And after all the results come, we will combine the doctors from the uh, eye doctors, from the kidney doctor, from the heart doctors, from the doctors of joint clinic, and they will combinedly assess you.
Okay. Okay, doctor. So, do I have hope, doctor?
Yeah, actually, it is a condition that can be controlled with medication, and we call it steroid medication.
Okay. Okay, doctor. That's all right. That's all right, doctor. And my eye issues, will that be solved? What do you think?
It's likely that it will respond to the treatment.
Okay, then it's very good, doctor. I'm very thankful to you.
Okay. Do you have any other concern?
No, doctor.
Is it okay if I examine you now?
Yes, doctor, please.
Okay, first I will go for the hands. Uh, if she can straight her arm in front of me to see any weakness, that she had a stroke past, any pronator drift.
Yes, yes, you can. There is no problem with that. You can do no pronator drift.
Okay, then I will assess the pulse, if there is any atrial fibrillation or not. After that, I will see the hands for any signs of rheumatological condition, like any signs of rheumatoid arthritis changes. And
No, no.
after that, I will ask her to raise her arm above the head to see any proximal myopathy. Then
Yeah,
I'm going to touch your area. If you feel any achiness or soreness, let me know. I will stop there. Then I will assess if there is any pain in the shoulder girdle area.
yeah. There is some pain.
Okay, I'm sorry for that. And after that, I am going to see the head, and if there is any visible temporal arteritis or not. And I am going to see any signs of inflammation or around the area, any redness or any swelling around this area.
I think some redness is present.
Okay. Did you get any injury over this area?
No, doctor.
Okay. Then I am going to feel it if it causes pain.
Yes, causes some pain.
I'm sorry for that. And then I'm going to see the eyes. And at this point, I need to do the fundoscopy. But for the time being, I cannot do that.
Oh, yeah, yeah. Okay.
And then I look for the anemia, then any oral thrush or any oral soreness. And after that, I will assess for the thyroid gland. And then I will ask her to stand up from the sitting position without using her arms.
Okay, doctor. It's difficult.
Okay. At this point, I need to measure her blood pressure and also do the urine deficit test along with random blood sugar level measuring.
Okay, doctor. I think it's quite normal now.
Okay. Time off.
Okay. Okay. What's your diagnosis? What do you think?
For this lady, my diagnosis is this is probably a case of polymyalgia rheumatica that is associated with giant cell arteritis or temporal arteritis.
Okay, how can you, what will be the investigations?
For this lady, I will go for the complete blood count to see anemia and white blood cell count to see the levels of white blood cells, and then I will go for the ESR that is likely to be raised, and inflammatory markers like CRP. Then I will go for the liver function test, renal function test, urine for routine examination, then random blood sugar level, HbA1c levels, and cholesterol level. And after that, I will also go for the ECG, echocardiogram, and also I will go for the temporal artery biopsy. But temporal artery biopsy shouldn't be delayed, but treatment shouldn't be delayed for the temporal artery biopsy.
Oh, okay. So, and what is the treatment?
For this lady, as she has also involvement of the eye, so the treatment should be a multidisciplinary approach. First, I will educate and counsel her about the condition. Then I will I will involve the multidisciplinary team like rheumatologist, endocrinologist, and then cardiologist. And in the meantime, for her emergency management, I will go for the uh, uh, steroid like prednisolone 60 milligram, and she
Okay,
will be admitted.
okay, 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 doctor. I think you have done really, really well in this patient,
Also,
and
and also I will involve the ophthalmologist, social healthcare department, and occupational healthcare department. I forgot to mention this.
yeah. Okay. So I think you did really well. You cracked almost all things, and I think it's quite well. I don't have too much things to say actually about your presentation and about your case cracking. I think you have done it very good. Do you yourself want to add anything, or Dr. Haitham wants to add anything?
Dr. Haitham is the wisest person among us, so he'll be very good person to opinionate on this.
Yeah.
I have kids around me, so it's better not to mention anything.
No. Go for that.
No, you can say there is no problem. You can say.
As you mentioned, he did it really well, but the headache itself should be analysis. Something missing, I think, scoring of the pain.
Yes, I
Scoring of
just
the pain
remember.
you mentioned.
Yes, I
Mm.
Yeah,
forgot.
actually, that scoring actually was forgotten. But the other things he actually asked about site, onset, any radiation, any timing. He actually asked those
Mm.
things, any betterment or course, but scoring was not done actually. That's right. And actually, I cannot.
Otherwise, and
Yes,
you mentioned the management. I missed the management. You mentioned the high dose steroid.
yes, he mentioned it.
Yes, I did.
Prednisolone
You
Right.
60
mentioned as high dose
uh,
1 milligram per kg.
milligram. I think.
1 milligram per kg.
1 milligram per kg. Yes.
Yeah, yes, 1 milligram per kg. He told directly 60 milligram actually, but I think it's 1 milligram.
Fine.
Another thing,
Yes,
another
fine.
thing that yes, another thing could have been added that considering the age, I think if it's given for more than 2 weeks, some bone protection can be given. I think this can be added while telling the
Yes.
treatment. Okay.
Yeah, treatment usually maybe went for a year, sometime 2 years like this.
Yes, yes. So I think Dr. Monilal, you should have told this, considering her age, that we
Yes.
might give you some bone protection as well. You should tell this.
Yeah.
Okay. And anything more?
Nothing more. Thank you.
Yeah. So, Monilal, do you yourself want to add anything?
No.
Okay. So I think
Okay, I
this
cannot
case
remember
is.
if I asked about any limiting or aggravating or relieving factors.
I think you asked. I also cannot just remember at this moment, but I think you asked. But you asked other things. You missed some Socrates points. Okay.
Yeah.
Okay.